While you're still just continuing to introduce yourself, I will get started because we have got a really exciting program today. For those of you who don't know me, my name is Inge Nickel and I'm the director at the Brazelton Centre here in the UK. So, as I said, today we've got an amazing program. We've got three speakers who are going to talk. Some are going to talk about how they use the MBO and family hubs. And we also got somebody who, Siofra, who's going to talk about how she uses the MBO in a different service as well. But really, it's about collaborative working today. So today's webinar is called Connected Care, and it has a focus on using the MBO in family hubs to strengthen shared relationship-based support for babies and parents. So we have really, really fortunate to have family hubs across the UK, which are bringing together services and support families from pregnancy through the early years, creating welcoming joined-up spaces where parents can access the help they need when they need it. And within these integrated teams, professionals such as midwives, health visitors, perinatal mental health practitioners, children's centre staff, and parent infant specialists can work side by side to offer coordinated relationship focused care. So from the Brazelton Centre UK, we have trained many different practitioners who are working in family hubs and using the NBO to support delivery of the core healthy baby services, which include perinatal mental health, parent-infant relationship, and also infant feeding. For those of you who are already using the NBO, you'll know that really it fits into all of those different services. And for those of you who are not yet using it and would like any more information, do please visit our website. And as the government has just announced, there will be more, and they are in the progress now of setting up new Best Start family hubs, and we'll hope to be able to support those as well. And if there's any of you here in the audience today and you need any more information, please feel free to contact us. So, for those of you who may not know about the MBO, I am just briefly going to describe it. So, the Brazelton Newborn Behavioural Observation, which we call the MBO, provides practitioners with a very powerful tool to support these aims. And the MBO approach helps families understand their baby's unique communication cues, strengthen early relationships, and promote confident, responsive parenting, which are all core ambitions of the Family Hub model. So, in this webinar, we'll explore how the MBO is used within family hubs and across local systems to enhance collaboration between services, enrich the experiences of families, and build shared understanding among professionals working with families. So today we have three speakers, and our first speaker is Sarah Clark, who is a specialist health visitor for perinatal infant mental health and family hubs workstream lead for the parent infant mental health team in Bristol. So over to you, Sarah.
Thank you so much, and thank you for inviting me to speak today. I'm going to share with you how we've been integrating the MBO into Bristol over the last couple of years, and to inspire everybody, hopefully, to see how amazing the MBO is in achieving the aims of family hubs. So I'm Sarah Clark, and here to talk to you today about how we've introduced the MBO and Brazelton approach into Bristol family hubs. So thank you for listening today, and I've left a bit of time at the end if anyone has any questions as well. So I think this very famous quote, probably a lot of you have seen, just really sums up the power of connection using the MBO. And it really is a truly magical thing for the baby, the parent, and for the practitioner. So imagine the first time a parent looks into their newborn's eyes. That moment is really powerful, but can also feel really overwhelming. And using the MBO across our system with families is equally powerful. So a really simple tool that can transform these moments into opportunities for building connections and confidence. So we all know that the first 1001 days is really important for a child's lifelong mental health and well-being, and that this takes a whole systems approach to supporting infant mental health and the parent-infant relationship. And particularly that first 3 months is really key to laying the foundations for that lifelong mental health. So within Bristol Family Hubs are 3 core principles that we use to support families is access, connection and relationships. And strengthening those early relationships is really key for us to be able to provide that family with that lifelong support model. So wherever a family goes within our system, they should all receive that same compassionate, shared approach to supporting families. So for those of you that aren't familiar with Family Hubs, say within this particular strand, it's supporting parents around their mental health, and that's birthing and non-birthing parents, but also really importantly, that parent-infant relationship. And as Inga said, the new Best Start Family Hubs programme funding has been announced for another 3 years, which is amazing. So one of the really key things that we wanted to think about when we were looking for as a tool to use with families to support them was around equity, making sure that we had something that can support all of our children and families, and that it was really inclusive to help improve child outcomes. And the idea around collaboration was really important, and the system working together. So making sure that whatever we decided to use was going to ensure that staff were working together and training together. So how has the MBO supported our family hub aims and outcomes? So it fits really well with our relational and partnership approach. So it's partnership with families and also with each other. It's provided a shared language that we can use with parents and also within conversations in our system. And it really does bring the baby's voice to every conversation. So whether that's with parents and families or other practitioners, right through to discussions that had at strategic level to ensure that the baby's voice is heard every time. We wanted an evidence-based flexible tool that can be used by multi-agency practitioners. So the MBO really fits the bill for that. And something that really promoted that sensitive and responsive parenting, and really importantly, those moments of shared joy. Thinking back to that quote at the beginning about those moments that take your breath away. As somebody that uses the MBO with families, I would say this is exactly what this does. And a strengths-based approach, so moving to a place of curiosity so that we can empower parents, reduce anxiety. We know the evidence is there for the impact that this can have on parents' mental health and well-being, and also moving us from positioning practitioners as being the experts, seeing the baby and the parents as the experts in their relationship. I'll talk a little bit more about this one a bit later, about how it supports the UNICEF Baby Friendly Initiative relationship standards, which was really important to us. And thinking, as I say, really importantly about that equity of access to a relationship building tool. So it's universal, it's inclusive, and can be used with every single family. Promotes collaborative working and a whole systems approach, so we're all using the same language and really thinking about that baby's voice and how they communicate with their parents. And it also helps to provide support for referrals when they're needed if any challenges have been identified in the parent-infant relationship or parents' mental health and well-being. So from a Family Hub's perspective, say we really wanted a tool that supported that preventative approach. So often tools and strategies are used kind of to intervene with coping strategies when parents are finding things really difficult and children are struggling. And the New Family Hubs programme is going to be really focusing on good levels of development, so school readiness. And to do that, it's really important that we kind of support families right from the moment of pregnancy in those early few months to be sensitive and responsive and to build a secure attachment. So within our system, we launched our new pathway, which we were really honoured to have Inga come and speak at last year. And all of these services and communities within our system, we were really trying to think about how can we make sure that we kind of offer the MBO training to the right people within the system to make the most maximum impact. So it was really important to think about kind of having that buy-in from all our key stakeholders and leaders within our system. So we had initial discussions and meetings with the Braston Centre, and then as champion meeting before the training and then regularly throughout the training to make sure that our leads were able to offer the support to staff that was needed for them to progress to certification, and then additional support plans for staff who needed that extra support. So we started off with mapping out which services within our system already offered the MBO to families, and it was mainly within our NICU teams and specialist community perinatal mental health teams. So we wanted to think about who kind of has that regular contact with families on a daily basis, and how can we best make sure that this MBO tool is used to the best effect. So we identified these key staff groups who have that regular contact, again thinking about that equity and universal offer. And I'm going to talk a little bit about how each of these services are used in the MBO within their roles. So we're really pleased. Our target was to have 200 staff trained within an 18-month period, and we got 205 staff trained. So just looking here, the dark blue is just to represent how many staff have certified following their training. The light blue and the green are the staff who've either moved on or due to their leadership roles are not in direct contact with families, so are not due to certify. But the remaining 22 staff, we've got 13 due to certify in the next 3 weeks, and then the rest who are on long-term leave will be supported to certify when they come back. And I think one of the things that was really important for us was that it wasn't just about doing the training. To be able to really embed this, we really wanted to support our staff to certify so that they could really understand and embrace the tool. So just thinking about the breakdown really of the numbers, so you can see how we allocated places. The biggest proportion was within our public health nursing roles, and then family hubs, infant feeding teams, our voluntary community sector, and we have a small team of primary infant mental health specialists as well. And just to say, within maternity, we have a local champion who was also within maternity services, who invited Inga to come along earlier this year and speak about the Brazelton approach with maternity, so that we're really thinking about embedding it from that pregnancy period onwards. So as with anything that's new and on a large scale and a transformative piece of work, we anticipated that there might be some challenges to navigate, and we wanted to think about the solutions to that beforehand, as well as addressing things as they arose. So time and staff confidence were the two key areas that we really needed to think about. And so working with our leads in our different services, we were able to identify appropriate visits and additional time to practice for their certification, and also allow additional time for them to be able to reflect and write up their observations while they were practicing. Time to reflect on their learning after training and to build their confidence so that we can embed it into practice is also really important to think about. So as a champion, I've offered a lot of reflective practice sessions for peer support, set up chat groups, and staff can contact me at any time for a one-to-one. Brazelton, I have to say, have been absolutely amazing. They've gone above and beyond in supporting before, during and after the training. And we've had a couple of additional update sessions with them to really support with the certification, and also allowing our staff time to attend the amazing Brazelton reflective practice sessions that are offered free to staff. At any point they can attend these if this is helpful, and I would definitely say that they are helpful. And for staff in leadership roles who attended the training, if they wanted to certify, they were buddied up with health visiting teams to support them to be able to access families through the baby hubs so that they could practice using the MBO. So I just want to think now with you to share how we're using the MBO in our different roles and how it all fits together so that we're really collaborating for the families. So within public health nursing, which includes our family nurse partnership, the MBO is offered at all new birth and 6 to 8 week visits within the home to really support that relationship building, and it's woven in so that it really supports the delivery of all the public health messages to families. We introduce the Brazelton approach in antenatal contact so that parents are able to think about their baby, bonding and getting to know their baby. And it has really helped to support kind of the philosophical underpinning to our recent service transformation as well, thinking about that baby's voice. I'll talk about the antenatal course shortly as a multi-agency offer, and our weekly baby hubs that we have running across the city. The MBO is used here, and resources are shared with families through this and also through our public health nursing website. And within our mandatory perinatal infant mental health training, the MBO and Brazelton approach is woven throughout as well. So I just wanted to share a few quotes. So it's not just me who's recognising the impact, it is all our staff. So I'll just give you a moment just to have a look at a few of the quotes from leads, health visitors and students. So I think you can see from a leadership perspective, they really value the MBO and see how this fits with the work that we do. I think some of the words that really jump out to me are about the amazing training, how enlightening this tool is, how it builds confidence in working with families, and also building that practitioner and parent relationship as well as the baby and parent relationship. And one of our students used the MBO training to support her leadership module, so thinking really innovatively about how we can support babies better when they come into our baby hubs and they're weighed, thinking about babies' comfort and supporting their states during that time, and it just being a very strengths-based and infant-centred, infant-led approach. So, as I mentioned before, the MBO really supports the UNICEF Baby Friendly Initiative relationship standards, which have been updated this year. And we really work closely with our infant feeding teams and with our infant feeding workstream lead in family hubs, because we know that that feeding relationship is really, really key and so connected to that parent-infant relationship, and being able to observe that baby and support those close and loving bonds. So the infant feeding team, so the specialists within health visiting and our peer supporters within our family hubs teams, use the MBO as part of their feeding assessments and support visits and within their peer support groups. They're also part of our antenatal course, so again, I'll talk about that later, but it's just been really amazing to see how when we think about the concepts of building a happy baby, the MBO really does help to support that. And again, a few quotes just to highlight really how the feeding team has seen the value of this, so they're not just thinking about feeding cues, they're really thinking about helping to support parents, to support their babies to regulate, and to support parents around those really common anxieties around sleep. So it really, really does fit really well within this service as well. And even, if they're not necessarily using the items, they will really be including the language and the observations of what's going on for that family. And again, highlighting the value of those reflective practice sessions. So within our family hubs, the support workers integrate the NBO into many of their baby groups. They also co-deliver the baby hubs with the health visiting teams. And so the NBO and observations are used within conversations with parents and within infant massage courses as well. And as you can see from the quotes here, the idea of working collaboratively together, thinking about that work in baby hubs and parents coming into other groups, what they've noticed is that parents come in and they're really excited to share what their baby's communicating with them because they've had those contacts with their health visitors, and really understanding those states and cues, so we can really see kind of the impact following those initial NBO sessions with families. And again, the lead's really supportive about the huge benefits of that consistent language across our system. So as I've mentioned, we have a multi-agency 4-week antenatal course run at various sites across the city each month. So this includes our family hub staff, midwives, infant feeding teams, dad matters and health visitors. And we've woven the Braston language and approach throughout all of those sessions to support bonding and getting to know their baby. And the NBO is introduced to parents during the health visitor session. And the feedback from the parents to be is that they've really enjoyed hearing about the baby states and communication and watching videos and joining in activities to think about supporting that understanding. And then when the health visitors have seen them after their babies are born, they're really able to connect with that within the NBO as well. So we commissioned some VCSE services through family hubs in Bristol, and it was really, really important that as part of our system, we also included them in this training. They support a lot of our families with perinatal mental health and parent-infant relationships, within home visits and group sessions and dad matters, as they're also part of our antenatal sessions. So it was really important that this offers another opportunity after they've seen the health visitors, if they're being supported by these services, to continue with that NBO and the Brazelton approach, so that parents are getting increasing opportunities to learn more and share more about their amazing babies. So a couple of bits of feedback again, and so I'm happy for the slides to be shared if that's something people want, so they can read these a bit more. But thinking about kind of birthing and non-birthing parents as well, again, it was really important to us that we had a tool that supported all parents and carers, that includes foster carers as well, in thinking about building that trusting relationship and supporting parent confidence and bonding. So it's been really great to hear and see again how, it's kind of not a one-off thing, it is an approach that continues to be used throughout the system. And then our team of primary infant mental health specialists who have also completed the training use this in their therapeutic support visits with families. And they also offer reflective practice sessions with our health visitors and family hub staff. So bringing in that Brazelton approach in their reflective conversations to really think about, what is that baby telling us? What are their needs? What are their strengths? And the fact that, as I say, this is a really strengths-based approach to working with families has really helped to support that work that other practitioners have through these conversations. So this for me is one of the main kind of reasons that we do this, is to see how this impacts on babies and parents. So I just wanted to highlight just 4 quotes here really from parents out of the many, many families who have received the MBO in the last couple of years. So I'll just let you take a moment just to have a look at those. What we've tried to represent here is, that the MBO approach is amazing, as say, it kind of really helping, not just with first-time babies, but with twins, with, subsequent babies, just to really highlight how unique they are and how they're really trying hard to communicate. And also those moments of shared joy again that using the MBO brings to those babies and those parents. And the last one was from a young dad, and just thinking he really wanted to be able to sort of be part of it and support his partner and the baby, and the idea that this has really made parents feel confident in reaching out for support if they're worried about anything as time goes by. So we're really proud of where we've got to so far with integrating and embedding the MBO into our system work in Bristol, but we know that we can still achieve a lot more. So our next steps here are just really thinking about that additional support for health visitors around integrating this tool into their holistic assessment. So I've got another champion working with me now, which is fantastic. So we're going to have capacity to develop additional resources and support plans and peer support. Working with Joanna from the Braselton on an EMBO evaluation. So thinking about how we're going to evidence the impact of this training and the use in different roles. And the evaluation will also include capturing feedback from parents and carers as well. Building on previous work to really embed the Braselton approach in maternity, and continuing to increase access to resources across our system and in the community. And we're really fortunate that we've got another training course coming up in January, and we are just now working on plans for the future so that we can sustain this amazing offer. So I just wanted to really just share with you a bit of personal reflection from the perspective of leading and coordinating the rollout of the MBO training. And again, I've used the word enlightening. I think once you see it, you can't unsee it. It is just, the most fantastic thing to be able to use and share with a family, and to bring that baby's voice and see that joy. I can honestly say it is the most amazing training I've ever attended. The trainers are so knowledgeable and passionate. And as I've mentioned, the support from the Braselton team has actually been amazing. They really do go above and beyond support. So when you're thinking about buying in and implementing training, that aftercare and support is really important. And I can honestly say that it's been fantastic. The resources that are there for practitioners and families are amazing. And now being part of the Champion Network provides additional support to me so that I can continue to support the practitioners in our system. And I just wanted to finish really with the words from Dr. Braselton. So every time you give a parent a sense of success or empowerment, you're offering it to the baby indirectly. Because every time a parent looks at that baby and says, "Oh, you're so wonderful," that baby just bursts with feeling good about themselves. And I think when we think back again to that quote at the beginning about those moments that take your breath away, this is it. So thank you for listening. I've got time, I think, for a few questions if anybody has any. I hope that this has been informing and inspiring, and my contact details are there, so I'm really happy if anybody wants to contact me outside of this to ask any further questions. So thank you for having me today. And Charlotte and Shifa, I'm really sorry I'm not able to stay on, but I'm really looking forward to hearing the recording of your presentations as well.
Thank you so much, Sarah. That was really, really amazing. And it's amazing what you have achieved in Bristol. That kind of collaborative working with the focus on the families and the babies just kind of stands out here. I love your first quote about the importance of actually it's the moments that take our breath away. That's so important.
Mhm.
I think that's great, and when you said it, I could just hear Professor Kevin Newton's voice because he talks about the MBO and facilitating the moment of meeting, and that is the same sort of thing, isn't it, Sarah?
Mm.
You just see the parents go, "Wow, my baby can
Yeah.
do this," and you can just step away. You've done your job. You facilitated that connection. So yeah, well done. It's absolutely wonderful. So I just wondered if there's anybody's got any questions for Sarah. We definitely got a bit of time. Um, Amy, how will our preterm cohort access this great resource as Miss Antenatal and Discharge Outreach rather than health visiting? So I don't know, Sarah, if that's something you can answer what happens in Bristol with preterm babies.
So the NICU teams do offer the MBO to parents while they're there. And then if they're discharged still within that 3 months, then they will still get a visit. So yeah, they will still see a health visitor. So if they're within that 3 months, they will still receive the MBO. But even if they don't, and they're past that 3 months, being able to use the items, then the approach and that kind of observation and reflection and really saying, oh, what are they trying to tell us, thinking about their kind of, states and sensitivities, that's still used. So yeah, that approach still is there to support those preterm babies when they come home as well. I hope that answers your question.
Thank you, Sarah. And any other questions? So,
Appreciate it. It was a bit of a whistle stop tour as well. I think I
yeah,
get very excited and yes, whiz through a lot. But yeah,
yeah.
so I'm more than happy for people to contact as well.
Well, it was such a, there was so much information, but really great within that presentation. Thank you so much, Sarah. And just to sort of add to the sort of question, if you have got any questions, then please do contact us. There are many units across the United Kingdom where staff are trained to look after the babies who are in neonatal care. And the MBO is used from 36, 37 weeks gestational age, but you can still observe the babies before that. I know we've got somebody here from Sweden who said you're NIDCAP trained. And it's a similar sort of thing that we can still observe babies without disrupting their growth when they're really small and they come into the world a little bit too early or very much too early. But we can carry on with corrected age so they don't miss out. And in several places, there are outreach workers from NICU who will use the MBO to facilitate that discharge because it can be really, really scary for parents when they take a baby home that has been looked after by so many professionals and then suddenly they're in charge. And what the NBO does is really highlight who the baby is, and it allows the baby to say, hey, this is me and this is who I am. And This is how I can communicate with you. So they have a sense of taking a baby home that they are able to understand and look after. So do let us know if you do have any other questions. We're always more than happy to to talk to you. Sorry, there's a couple one more question. How many days does the training process take and what is the cost? So there is more information on our site about that. We run online courses or in person if you want to have your own course. The training itself is 2 days that you attend, but then there's a practice period and some people will complete it within a month, and some people take a lot longer. So it really just depends how much access you have to babies. And the cost here in the UK is £480. That includes all the training, support, certification, and it's lifelong support that you have with us from the Brazelton Centre. So if you have the MBO training and you go away and you have children or you move abroad and you come back again after 10 years, you can pick it up. Just go and attend the reflective sessions, as Sarah already mentioned, and you can just take off again. We'll support you back into it again. And yes, Betty, thank you. Just saying also, some of you will probably be aware of EI Smart as well. And of course, the EI Smart and the Brazelton approach just lies, yeah, they go hand in hand. And again, they have some amazing resources, particularly also with the focus on the preterm baby. So please go and visit their website as well. And they're running a wonderful thing in December where there's a new little message every day. And today it's actually about a leaflet that the Brazelton Centre and EI Smart has produced together or developed together on screen time and babies. So yeah, please go and have a look at their wonderful resources as well. So we are going straight on, and we are going to have the next speaker. So Charlotte,
Good morning.
good morning. So our next speaker, we have got Charlotte Gatehouse, who is the Start for Life lead in Portsmouth Family Hubs. So welcome, Charlotte.
Thank you very
And
much.
you.
Okay, now I'm having just trying to, how do I share? It's not coming up with my presentation for some reason when I'm trying to share.
Ooh. Sarah, is Charlotte co-host?
I've just made a co-host, so it should hopefully work now. Sorry, Charlotte.
That's all right. Technology is not our friend. There we go. Lovely. Thank you very much. Can everyone see that?
Yes.
Okay, so I'll show you. I cannot see any of you anymore, so please somebody let me know if there's anything that needs to be interrupted for whatever reason. So good morning, everyone. As introduced there, my name is Charlotte Gatehouse, and I'm the Start for Life lead for Hampshire and Isle of Wight Healthcare Trust in the area of Portsmouth City down on the south coast. So my background is as a health visitor. I've been a health visitor for about 15 years, and for about 5 years before starting this role, I was the specialist health visitor for perinatal and infant mental health for the city. That was both a strategic and clinical role. And then when we were very fortunate in Portsmouth to be part of the original Family Hub and Start for Life project, I took on a role leading on two particular and often very interrelated parts of the Start for Life programme and funded work streams, which are perinatal and mental health, parent-infant relationships, and our infant feeding programme. And as Sarah sort of talked about there, the Family Hub and Start for Life programme was additional funding that was provided to 75 local authority sites in England. And those 75 sites were selected because they had the highest levels of deprivation and need. And so whilst many of the core values are about providing those communities with universal support, there was also recognition that there was a higher need within those areas and higher risk factors. Now, when I came to do the presentation today, I know Sarah well. I know Sarah's story well. Our paths have crossed many times as specialist health visitors within the Family Hub world and as both now sharing roles as Brazelton champions. And I was really conscious that there would potentially be a lot of duplication between what we might talk about today. Sarah beautifully talked about how many of the Family Hub aims and ambitions, she talked about those ambitions of improved connection, improved relationships for families, improved access to support as being core values of our Family Hubs and how they beautifully align with the Brazelton approach and the MBO system. And I really wanted to build on that today and share a little bit about some of what we've done in Portsmouth, but also try to bring that alive for you. Now, part of my job is data, and data is really, really important, looking at those quantitative figures. And we do use that to measure the success of implementing things like MBO, both individually for families and more widely, systemically. But it can be a little bit dry. And for me, data that doesn't have a story doesn't have a soul. So what I'm going to try and integrate into my presentation is a few case studies as well. One of the huge benefits that we see of newborn behavioural observation is how it brings a voice to the infants themselves. It helps to tell their story. It helps to tell family stories and journeys, but also the impact it has on practitioners and their practice and being able to hold all the family members in mind. So with that in mind, I have changed names and some of that information so that we can ensure that we protect the confidentiality of those involved. So I'm hoping that what I shared today will build a little bit on what Sarah said rather than duplicate for you. So what I'm hopefully going to cover a little bit is what our MBO journey is in Portsmouth, where we started to kind of how we've built on that journey, where we are now, and think about how we've implemented that that support using the grant funding that we were provided through the Family Hub and Start for Life offer, and how we've implemented a progressively universal approach to that, which is one of the core values of the Family Hub and Start for Life programme. And I will think a little bit about what's next for us here in Portsmouth. As Sarah alluded to, we're really fortunate that we know that there will be ongoing funding to really embed and build on the systems that we've created for our families. So to start with where we've been really, I think it's important to note that before we went into the Family Hub and Start for Life programme, the newborn behavioural observation wasn't entirely new to us. So if we take our journey back before 2020, we did have some newborn behavioural observation, but that sat in highly specialist services, generally within our specialist perinatal mental health team, which meant it was only available to parents or to the birthing parent who was experiencing moderate to severe mental health difficulties. It was also available, Amy, you asked in the chat earlier about preterm babies, so it has been available since before 2020 within our NICU, but only whilst those parents and infants were within the ward-based environment. And in 2020, I was really fortunate that I was able to train as an MBO practitioner, but as one person who worked part-time during that period, and a little bit of a complicated year, I think we can all agree. In 2020, I was only able to offer that in a really limited amount. So we had to do that through referral criteria that related to both vulnerabilities for the parent and vulnerabilities for the infant. And that meant, the offer was very, very limited. But we knew that we wanted to expand that offer, and I knew that I've done that training. It sparked something in me that said, this is such a fantastic approach to work with families. It is hugely strengths-based, it's collaborative, it's so easy to incorporate into health visiting practice. How do we expand that? And we have a fantastic network of perinatal and infant mental health champions who are supported by the Institute of Health Visiting, who were really interested in this approach and applied for our continuing professional development funding, which all registered nurses within England can apply for, which helpfully is around £450. So as Ing said earlier, very similar to the amount that the Brazelton training is. And we're fortunate to be able to go and do that training, and I suddenly had a little team of 4 who were able to offer that targeted support for families. But again, really limited amount, so we were only able to offer that on a targeted way. Now, Sarah talked earlier about the Family Hub programme and the aims and ambitions, and that when we look at the scope of the programme, they're very clear that when we talk about parent-infant relationships, what we wanted was universal support, and universal support that really focused on promoting positive, sensitive early relationships. So for me, when I was looking at that part of the scope and we were thinking about how did we promote positive relationships in Portsmouth, we wanted to make that a universal offer. And the easiest way to do that is to implement it into our universal services, where every family is seen during that early postnatal period time. So we used some of that funding to train our health visitors so that they could integrate that into those mandated contacts. And I'm going to talk a little bit more about that later on. Now, in addition to that, the programme guide is also very clear that we need to expand the reach of the services that we provide families, and we need to think about how we provide support, targeted support, early targeted support for individuals who might be experiencing more mild to moderate mental health difficulties. And I alluded earlier that prior to this funding in Portsmouth, we were only able to provide that for those who are experiencing moderate to severe difficulties. So we train dedicated staff to be able to provide targeted interventions. And MBO is one of the interventions that we provide. And I'll talk again a little bit more about that later. And the final thing that we've been doing is looking at how we expand the reach of parent-infant support in general, but also the MBO approach in Portsmouth. And again, a core part of our Family Hub and Start for Life national programme is how we become more father inclusive in our services and how we expand the reach of services and offers to dads, fathers, male carers within children's lives. And all the evidence suggests that actually male carers often don't relate to those universal services such as health visiting and maternity. We are often very women-centred services delivered by women, and they find it much more relatable and accessible to work with male-centred services. So it was really important for us that we provided that as part of the Dad Matter service that we commissioned in the city. So as I said earlier, when we were implementing the MBO into Portsmouth Family Hubs, we were very clear that we wanted to offer that as a progressively universal service that really supported our ambitions to improve accessibility and expand the scope and reach. So for anybody who maybe not be familiar with the idea of progressive universalism, it is a core part value of the Family Hub and Start for Life programme. It's also a core value of what's called the Healthy Child programme. For those of you in England, you might be really familiar with the Healthy Child programme. For those of you who are not, the Healthy Child programme is a universal programme available to every single child in the city. We have an under 5 programme and we have a 5 to 19 programme. And it outlines the screening, the immunisations, the visits that they should receive from both maternity and health visiting services to ensure that we are providing health promotion and prevention information and identifying those children and families who need additional support as early as possible. And progressive universalism ensures that there is universal access to absolutely everyone, but there is proportionate additional support for those who need it the most. So when we think about that universal offer, as I said, for me, it was really about integrating that into what we already had within our system, which was our health visiting service. And we have wonderful opportunities to integrate that into our mandated contacts. So every child in England is offered a review with a health visitor. So health visitors are nurses or midwives who've taken on additional training around public health and children and families' health. And they're offered a visit with that professional between 10 to 14 days and 6 to 8 weeks, and for some families also between 12 and 16 weeks. So anybody familiar with the MBO will know that those are beautiful opportunities for us to be able to offer and integrate MBO into those contacts within that timescale that we know that MBO can be really helpful and evidence-based up to that kind of 3 months postnatal period. Not only that, but actually the MBO aligns when we look at how we work with an infant and family, what things we're looking at and observing in the infant. They align really beautifully with what we are asked as health visitors to include within those mandated contacts. So what I have found is they create a beautiful structure to that mandated contact that makes that contact much more interactive. So really important for us in Portsmouth in particular, because our adult literacy rates are quite low, often reported to be around on average of age 7. So written material, lots and lots of information can be really overwhelming for our families. So having such a visual, collaborative tool is really helpful to frame our visits around. It also really brings the infant voice into those mandated contacts. It helps us to really think about their strengths and needs. And with that, it makes it really person-centred and individual. So, for example, some of the key things that we need to talk about within our mandated health visiting reviews include things like infant feeding, safe sleep, how we support our child's development, managing crying and soothing, and play and stimulation. And any of you who are familiar with the MBO and the activities that we undertake with an infant, you'll know that those are the things that we are looking at and hoping to observe infants' cues around and provide anticipatory guidance so we can build in all the lovely health promotion advice. So from a universal point of view, we have integrated it into those contacts and creating it as part of a framework for how those contacts can be delivered in a really person-centred, infant-focused way. But what was a surprise to me, but an absolute joy, was to see how much the staff use it as just making every contact count. I see them using it within clinics. So we run sort of drop-in clinics for mums and dads and babies to come along. They may be wanting to have their baby weighed or seek some sort of ad hoc advice from the health visitor, or we run a duty system where parents can call and have those conversations, and hearing the language and the approach used within those contacts, really bringing, as I say, the infant and that patient-centred, person-centred approach to it. The other part that's really important about integrating it into those universal visits is another part of our key family hub aims, and one of our aims with the Healthy Child programme is about that early identification of additional need. Now, what we need to be really clear about, the MBO is not a test. It is a wonderful, collaborative, strength-based tool that helps us to go on a journey to get to know that infant with that parent. And actually, often the parent knows that infant way better than they think they do. And that's the journey that we create. And it's not a screening tool, and it's not an assessment tool. But what it does do is helps to promote that safe exploration of the parent, of the family, and of the infant's experience. It helps to have those conversations about what the parent's perception might be of their infant or of their relationship, of how they feel, their perceptions of themselves as a parent, their confidence, and it helps us to observe the infant and bring a voice. So whilst it absolutely is not a screening and assessment tool, it can support that early identification, and particularly when we use it alongside screening questions and validated tools, which we know are recommended in guidance. And that really helps us to identify those needs and ensure they go onto those referral routes for additional support as needed. So I think it's fair to say, when I sort of first sort of let the health visitors know, and we were kind of really trying to engage health visitors with this change in their practice, they were a little bit sceptical. They were a little bit worried that this was going to be some additional work for them. I think it's fair to say that we know health visiting nationally is under a lot of strain in terms of capacity, and they were really worried we were going to be asking them to do more, when really what we were saying is we have such fantastic opportunities in our core visits. How do we improve the capability of our workforce to make sure we can offer really, really solid value within those? And what you can see on the right-hand side of the screen, though, is actually the impact that training had. So the Brazelton team very kindly provide a beautiful report for the training that we deliver to our health visitors. So all of our health visitors and community nurses in Portsmouth are trained. We are a much smaller site than Bristol. Our birth rate is only about 150 to 200 per month. So we have a total of 35 health visitors who are all trained within the approach. But what was really obvious after the training was how much it increased their confidence, not just in delivering the newborn behaviour observation approach, but just generally in how they work with families around parent-infant relationships, around parental confidence in that beautiful collaborative and strength-based way. And you can see here the impact it had on their practice and some of the really lovely quotes that it brought, and actually really the value that it's added to them, and help them feel really skilled, really supported and empowered to go forward and work with families. So this is a case study of how one of our health visitors incorporated NBO into their visits. So the background story here is that Tom is Ben and Louise's first baby, and both parents speak English as a second language. So our BAME community and our non-English speakers within Portsmouth is about 15 to 20%, I would say. So we have, again, a relatively high for the south of England community of ethnic diversity. And Tom was a planned pregnancy and there was no complications. And Tom and his family were both on a universal health visiting caseload. And what that means, for those who don't work in health visiting, is that we were not aware of any additional concerns for that family that might mean that they needed some additional support. So there was no health concerns or social concerns for this family. And the health visitor attended one of our universal new birth visits when Tom was about 2 weeks old. And both Ben and Louise were present at this visit. And that's something that's a really huge value, is that often when we go and do that new birth visit in particular, we often do find that both parents are present. If one parent is a working parent, they're often still on their paid leave, their paternity leave from work. And so we're also able to access that other parent, the non-birthing parent. But during this visit, both parents reported that they were really concerned that Tom had been unsettled. They were finding it really, really difficult to soothe him, and this was really understandably causing some worry and stress for the family. So during this new birth visit, the health visitor used the MBO tools to be able to explore Tom's behaviour together. And this included how he manages his environment, whether he was able to what we call habituate, sort of manage and shut out light and noise, or whether he found that really sort of irritating and disruptive. They looked at how he managed his sleep, his feeding, and how he was communicating with them when he felt stressed or overwhelmed. And the health visitor noticed that how using the MBO tool helped the parents to observe Tom and really view him as an individual. And together they explored some ideas which might support Tom when he was feeling unsettled. And one of those things they noticed together was how Tom was really soothed by sucking his hands. But his parents were frequently covering his hands with mittens, and the health visitor was being able to provide some anticipatory guidance and some reassurance that allowed the parents to feel more confident in allowing Tom access to his hands to use them to suck and soothe. When she went back for that 6 to 8 week contact, the parents reported that they had been learning lots that they'd learned about Tom from that first visit, and they felt they could recognise his cues earlier and had found the ideas about how to help Tom to manage his environment really helpful. The health visitor said that it was really evident that between the visits, the parent had been taking a lot more time to just watch and wonder about Tom and his communication, and Tom seemed much more settled at this visit. And that allowed the health visitor also that second opportunity to revisit the MBO tools. One of the really important things about when we administer an MBO is that we are led very much by the infant. And that means that we may not always be able to look at all of the items or all of the cues and activities with that infant, because it may be not appropriate and it may be actually quite intrusive or disruptive, and the needs of the infant and the family are always first. And one of the benefits of us incorporating this into our mandated reviews is actually when we come back at 6 to 8 weeks, it's that second opportunity to think about any of those items that we might have missed and sort of build on that journey, and also explore how infants' communication develops and changes over time. And they were really able to see that, particularly around his social cues and how he showed pleasure and enjoyment. And that had felt really difficult at that first visit because of the parents feeling Tom was really unsettled. And this also really helped to kind of, sort of that shared joy and build on that confidence. And the health visitor also has found, sort of reflected on how she'd been using MBO within these universal visits, and how she'd found it to be a really valuable tool, and sometimes how even just using it a little bit, as we said, making every contact count, using those opportunities had been really helpful, and she was now using it in all of her visits. She really found that something that was important about it was that we know that all parents learn differently, and actually having this really practical way of learning was really helpful for her families who had additional difficulties such as learning needs, or such as in this case study where English wasn't a first language. She also really felt that in this case study the practical involvement really helped to engage the father within the visit, and he really enjoyed sort of watching his baby's capabilities and celebrating those things together. I think a really beautiful example of how MBO can be incorporated into those universal services. And we haven't stopped there. We wanted to make sure, as Sarah said, a key value here of our Family Hub programme is that we have shared language and shared approaches that are available across our Family Hub systems. So we have integrated the approach and the learning into our universal antenatal and postnatal groups. So any family in Portsmouth City can register and attend 6-week antenatal courses and 6-week postnatal courses. And the groups are co-facilitated with one of our specialist health visiting teams who provide targeted MBO support that I'm going to talk to you a little bit about shortly. And so they incorporate the MBO values and system within those groups and activities. We've trained some of our maternity support workers, so they're able to offer MBO on the wards. And we've also, as Sarah said earlier, we've in the infant feeding services and our breastfeeding friendly initiatives are really well aligned with this particular work stream, and they are all trained to use it. And the feedback is they're finding it really helpful actually in their targeted infant feeding visits to help support families to think about responsive feeding, to think about their baby's cues, to think about how their baby might need more support to manage their environment during feeding sessions, how they may support an infant who is crying and settled, and looking at how this really, again, helps to really bring that uniqueness of the infant into those discussions about infant feeding support. And the other thing that we have done is developed MBO self-book clinics within our Family Hub. So families can just log on to our system and book an appointment within a Family Hub to have an MBO focus session. Now, this was really important to us because, as I said, we're very much led by the infant, and we know that there are sometimes competing demands and priorities for families when we go and do our new birth and 6 to 8 visits. If a baby is asleep and the parents do not want that baby woken up, we absolutely want to respect that. So we wanted to make sure there was an opportunity for families to access MBO and ensure there was that equity had they missed those opportunities in those universal visits for whatever reason. And also picking up, Amy, on what Amy said in the chat earlier about our neonatal unit. So we know that absolutely MBO is available within the neonatal unit. However, we know that these are infants that can find that adjustment to the outside world and the change of environment sometimes quite difficult. Sometimes their early experiences of things like touch can be quite difficult, and parents can often feel that they've really lost confidence when they leave that environment and the professional support and all of those things that are around them. So it's really important that they do have access to that. And we know that although we recommend the MBO being used up to 3 months of age, that is gestational age. So for those preterm infants, that is adjusted, and we want to ensure that is available. So we do have a targeted offer, but we also want to ensure that those individuals can self-book and access that as a universal offer, and we ensure there is equity within that.
Charlotte, can I just... oh, no, it's fine. It's moved. We were stuck on...
Oh, it's not going on. Lovely. So the second part, thinking about that progressively universal offer. So we've talked about how we make that as an accessible offer available to every family in the city. But actually, we know that a key Family Hub ambition is to ensure that there is additional support available for families, particularly those who are experiencing mild to moderate perinatal mental health or parent-infant relationship difficulties within the first 1,001 days. And as we saw earlier on Portsmouth's journey, right at the start, we had that support available for those experiencing more moderate to severe difficulties. And we were not alone in that in Portsmouth. We know that nationally there had been a lot of investment within the specialist perinatal services. But when we looked at the gaps, both locally and nationally for families, that support around mild to moderate difficulties, particularly around parent-infant relationship concerns, and accessible support around parents' mental health was also a significant gap. So as part of our funding, we developed a specialist health visiting team called Families in Mind. And Families in Mind provide a range of evidence-based short and medium-term interventions that are delivered flexibly via group and one-to-one, both in family hubs and outreach. Essentially, we will meet families wherever they want to be. And the criteria for our service is around those mild to moderate difficulties, but we co-designed our referral criteria with families and using language that they felt was recognisable to them. I'm worried about my baby. I'm not enjoying this. I don't feel confident as a new parent. I feel sad. I feel stressed. And we wanted to make sure that that service was really accessible. And so we co-designed the referral routes with families, and families can self-refer or they can come through a range of different professional referral routes. And as I said, this was a key ambition, was to provide improved support and improved outcomes around mild to moderate difficulties. And we know that the MBO there's evidence of where it can reduce maternal stress and depressive symptoms and improve early bonding for parents who might be experiencing things like anxiety or low confidence. And we see that by the way in which we work with parents helps to enhance that parental sensitivity. So that sensitivity, what we mean by that is parents' ability to kind of decode their infant's cues, so to be able to recognise their infant's behaviour, facial expressions and sounds as language, and then communicating with them and be curious about what that means. We know it can lead to improved infant regulation, and we saw that with that universal case study. Because actually that ability to decode infants' cues enables parents to be more responsive and recognise those unique needs. And it really helps to empower parents. The way that we work with an MBO with parents is really collaboratively, really respectfully, really supporting them to identify what they see in their infants. And that can really increase that sense of competence and reduce stress. And we know that it can really help to improve and strengthen relationships between the parents and the infant, but also between the parent and the professional. And I'm going to talk about the value of that in a moment as well. So as I said, as part of that targeted offer, we really wanted to make sure that was accessible. And those are the two methods that families can access it. And that offer that we offer from Families in Mind, we do offer MBO as a standalone targeted intervention, but actually more and more commonly we use it as a wider package of care. And that is because we know what we have found on our journey is that the MBO is a really strength-based and collaborative intervention, as I say, but it really aligns with many of the other parent-infant recommendations that have been promoted and funded through the Family Hub and Start for Life programme, such as video interactive guidance. The video interactive guidance is a really strength-based tool that we use with families where we take short videos of parents and infants interacting together, and then we edit them to show short stills, so photos or short clips of really strength-based moments where the families are communicating in a really attuned way together. And we do that looking very much at individual goals as well that the family have. But it's a really strength-based and collaborative intervention, and so much commonality that aligns between the MBO and the VIG intervention. We also know that, as I said, MBO is so non-judgmental, it's so supportive, it really fosters this early relationship between families and professionals. And this is one of the huge strengths we've seen actually as a targeted intervention. When we approach families and talk about VIG, it understandably feels really, really scary. Families can feel really vulnerable that we're taking photos, we're taking videos. It's terrifying, isn't it? None of us like watching ourselves back in photos and videos. We often feel really uncomfortable about that. And particularly if you're a parent who is experiencing low self-esteem and low confidence, their trust in us that we will show them strength-based things and their hope that things can be different can be really challenging for them. But actually, the way that we work with Newborn Behavioural Observation in this beautiful collaborative way, highlighting the strengths that we see in their infant, in the things that parents are doing to support their infant with their needs, beautifully aligns with VIG. And it helps us to build, set that ethos of how we work with families really early on and build that trust and rapport. And what we've seen is it's really helped families to feel ready to engage with more intensive interventions such as VIG. So VIG is recommended in NICE guidance around parent-infant relationship difficulties, and it is a much more intensive intervention. We tend to be at least 8 contacts, whereas MBO could be used as a one-off intervention. And that's been one of our real benefits that we've seen within the programme and strengths of MBO. Using it as a targeted offer as a standalone, though, also does allow us to go on a bit of a journey. So we're able to offer sort of 3 sessions of MBO. We were able to kind of build that journey over those first 3 months, looking at more opportunities to see their infant, but also to celebrate how that infant grows and changes, how their communication develops and changes over time. And I think as a targeted intervention, one of the strengths I've seen is promoting that as an ongoing thing that parents do, that watching and wondering, noticing their infant's communication, thinking about what that might mean and what they might be telling us, becomes really a sort of embedded part of their parenting that they take with them beyond that 3-month time that we might work with families with an MBO. So when we're looking at how we measure the impact of the MBO support, we use some fantastic questionnaires kindly developed by the Brazelton Centre that help parents sort of think about how helpful have their MBO sessions been. And on this slide, you can see some of what those outcomes are. And some of them very much relate to the parent and how they feel about being confident as a parent, how they feel about their relationship with that practitioner. Did it help them to share their thoughts and feelings? But also, has it helped them in terms of understanding and getting to know their baby? And quite consistently, we get told it either has a lot or some. I very rarely hear anybody say a little or very little at all out there. And here is a case study for you. So Amelia was Jane's first baby. And when Amelia was around 6 weeks old, the health visitor made a referral to the Families in Mind team. And during the initial contact, the Families in Mind team, Jane reported that she did not feel confident as a parent. She was really struggling to adjust to new parenthood, and Jane described how Amelia had a tongue tie and could be really unsettled, and she was finding soothing really difficult. She was feeling really worried about going out and attending groups because she felt really not confident in being able to settle her. And this was kind of leading to more feelings of isolation, which were further impacting on Jane's mood as well. So together, the Families in Mind practitioners agreed to offer some targeted MBO sessions. And we did that one-to-one within a family hub. And during the sessions, Jane and the Families in Mind team member watched and wondered about Amelia together. And they were able to explore the different baby states, their wake, sleep states, when they were ready to play, when they needed to have a break, and how Amelia communicated these through her behaviour, and consider what maybe she might need that was different in those different states. And they explored her early cues and how Amelia might show these, and how she transitioned between the different states, and looked at when she might feel stressed or overwhelmed, and maybe sort of thinking about how they might identify those early cues before she reached that point of crying that might support soothing and things. And they reflected on what she liked and disliked in terms of comfort and a very stepped approach to soothing. This was a baby who found being scooped up and rocked and sung to really quite overwhelming, and needed something maybe a little bit more gentle in that approach. And they invited them back, and they came in for a second session. And during that session, Amelia was much more settled, and Jane reflected on how she felt much less worried, and how she felt if she experiences challenges in the future, she would feel much more able to sort of take a step back, just watch and wonder, and maybe worry a little bit less. But one of the things that Jane continued to identify was that she felt really worried about attending groups and activities, but this was something that she really wanted to do. And we were able to offer that in Families in Mind. So we do offer some targeted group-based interventions for parents experiencing low mood and low confidence and enjoyment. But thankfully, that MBO facilitator also ran. And that relationship they built through the MBO sessions then enabled that mum to go on to attend the groups and activities with her. So again, a really positive story of where we see not only does MBO support the parent and infant relationship and support the parenting confidence, but some of those wider relationship-based with the professional, and how that supports them to engage with wider support out there as well. So some of the final pieces of the puzzle then, when we looked at the Family Hub programme and we looked at our existing provision, one of the key aims was about expanding reach and developing more father and male inclusive services. And we were really lucky that as part of our Family Hub funding, we commissioned something called Dad Matters. Dad Matters is a programme offered by Home Start, and we have a local Home Start Portsmouth who are a voluntary and community sector service, so a charitable service who offer support to parents with children under the age of 5. And the Dad Matters initiative aims to support fathers during pregnancy and that early postnatal period, and it helps to build strong relationships with babies, promote positive mental health, and ensure fathers feel included in services. And that's done through peer support, practical advice and signposting, and their overall aim is to really empower dads to have an active role in their child and family's health and well-being. In Portsmouth, we deliver this through sort of a universal outreach. So Andrew, our Dad Matters coordinator, and his team position themselves up in the antenatal clinics, just chatting to dads. They attend the NICU regularly and are available within our family hubs and other community events. And they also offer one-to-one targeted outreach support. So they will offer a period of time over there. So I think it's really important as well here that the professionals that we've talked about previously are predominantly those who come from registered backgrounds, who have some training and experience. And what you can see on the right-hand side here is what Andrew has said about his journey in attending MBO training and his experience of starting to implement that into practice. Andrew is one of our newer trained staff. He's only trained sort of a few months ago, so he's still very much on that certification journey. But he's really seeing how it's increased his confidence as a practitioner and supporting him to communicate with parents and babies, as well as increasing his knowledge and understanding around infant and parent-infant relationships. And Andrew kindly provided us with this lovely case study around a really vulnerable dad that he had been working with within Portsmouth. So this was a family who'd been referred to Dad Matters from Children's Social Care. And there were concerns around the parenting, and the child was subject to child and need plan at that time. Both mum and dad had experienced some quite significant adverse childhood experiences. There were some significant mental health needs and some concerns around sort of the home environment and homelessness. And after the birth, we saw that both parents' mental health also declined. And what they had also found was they were feeling really overwhelmed by the social care experience, by the number of professionals who were involved. Their confidence was hugely impacted because they felt they were under a huge amount of scrutiny as they were just trying to navigate this role as new parents. And this had led to this perceived sort of lack of engagement or disengagement from services. So professionals were at that point of feeling really worried within that. Now, fortunately, Andrew had been able to meet with the parents beforehand during the antenatal period and be able to start to build a relationship with Dad. And this meant that he was able to offer an MBO session within the first 9 weeks. And he completed this at home in an environment where they felt safe. And he's reflected on what he saw and learned during that contact. And he said, during my MBO at 9 weeks, baby was awake and alert and showing interest and moderate responsiveness in the activities, visually tracking a ball and orientating to the sound of a shaker from left to right. Baby turned to Dad when he called his name and began communicating using his voice to engage with his father. He had a strong hand grasp reflex, but some difficulty maintaining his head in the midline without support. He showed a fairly strong call response and fairly strong muscle tone in his legs and arms, and he showed a good state regulation, only became fussy when placed on his tummy. Baby was really easily soothed by Dad's voice and when held by Dad. And I think what that highlights as well is how we can bring the baby and the parent a little bit more into those high-level meetings like social care case conferences. And Andrew shared that after the MBO, the parents said that they felt more confident and they were feeling more secure and learning what their baby could do. They said that the experience assisted with building a positive relationship between Dad and Andrew, and this has really helped them to focus a little bit more on different sessions, to look at the baby's play and to build that relationship. And with that, what they have seen is really significant improvements in engagement with other services and how the family feel in terms of their relationships, their home environment, and things feeling just less stressful. So a really positive example of where we can engage with dads, but also how we can bring that infant voice into those specialist higher level services. So the final thing I wanted to think about, so when we think about progressively universal services, the final part of that puzzle that I haven't talked about is the kind of community element. And this is about how do we make sure that MBO is part of our community system in Portsmouth. And for me, a really big part of that is about shared language and integrated working and integrated pathways. So that even if practitioners are not trained to deliver the MBO in intervention as an intervention, they're familiar with the language, they're familiar with the approach, they're able to identify where this might be really helpful for families. We do that in a number of ways. So we've done that through training all of our practitioners who work with families in the first 1001 days. We use an Institute of Health Visiting Awareness model to do that. when you look at that model, it incorporates loads of information that is really familiar to MBO. We talk about infant states, and we've adapted that to look at what are our local models, what is our local shared language, and what is our local pathways to support. And we've also incorporated our Brazelton leaflets and our posters into all the places that new parents might be. So it goes out, the leaflets go out in our what we call our red books, our personal child health records that every parent receives as part of their antenatal and postnatal care. And there are posters and leaflets in our family hubs and our maternity settings within our GP practices, so that we are providing that information. Now, one of the things I alluded to earlier about Portsmouth, actually, though, is also we know that literacy rates are low in the city. It's an area that we are looking to improve, but that does mean that sometimes those leaflets and posters are not as helpful as they could be for families. And what we did earlier in the year was worked on a co-production project with local Portsmouth families to look at how we developed better digital resources and more accessible resources for parents, both around parent-infant relationships, but also around perinatal mental health as well. And this is a really core ambition of the Family Hub as well, about improving access and developing more digital information. And when we looked at the parent-infant relationship stuff, the parents really related to and valued the MBO approach. They really valued the infant states. They really valued that uniqueness and exploration of the infant's cues. And we worked together to develop some quick guide postcards. These were things they wanted to be able to stick on their fridge that used loads of really sort of visual imagery of infants and babies showing cues, and also some digital videos. And having the MBO language and approaches within that has really helped us to develop something accessible for families. Next steps, I think for us really it is about just really carrying on building sustainability. We've talked about training staff leave, and we need to continue to invest in that to ensure that we're able to offer that equity, and particularly offering that universal service. We're going to continue to embed that common language for professionals through that training and support for the first 1001 days. And we really want to think about continuing to support professional competence and confidence. So we have quite a high number who are certificated, but we know there are still some who are not feeling as confident as they could do. And so we really want to carry on with our plans around ongoing training, supervision, support plans, and buddy systems. And next year, one of the things that I really want to do is to think about expanding reach to vulnerable groups, and really needing probably to do that through outreach activities. So one of the vulnerable groups in particular that I'm thinking about within our city that is a high level of need is around our asylum seeking families, and that we know that they can often find accessing services a lot more difficult, and there are sort of multiple risk factors and challenges for them, both in terms of engagement with services, communication, and as well as their own emotional well-being and their relationships. So that's one of the aims for next year. And yeah, and that's it. And I added this quote because I think sometimes people really think of the MBO as one of those sort of little things in a vast majority, lots of, interventions that can be helpful around parent-infant relationships. But actually, often it is those little things that really do make a big difference for families. Any questions?
Thank you so much, Charlotte. That's really, really great to hear all the work that you're doing in the Hampshire and Isle of Wight area. So thank you so much for that. And it's great to see and hear some case studies as well. We are running over a little bit, so I am keen to just introduce the next speakers. But if you do have any questions for Charlotte, please put them in the chat. And we may have some time later to go through them. So we will probably run over a bit, so I hope you can stay with us. And if not, then the recording will be available for you to watch in your own time after today's session. So I'd like to introduce you now to Siofra Bradley, who's a clinical psychologist with NHS Tayside Maternity and Neonatal Psychology Service, and she's presenting today with Gemma King and Louise Lennox as well.
Great. So hello. So yes, I'm Schieffer Bradley, a clinical psychologist on the maternity neonatal psychology team in NHS Tayside, Scotland. And in true MDT fashion, it's myself, Gemma King from the maternity neonatal psychology team, and one of our health visitors in Tayside, Louise Lennox. So we're just here to talk a little bit about our use of the NBO with different professions, and our reflections on that. So we'll do a quick whistle stop tour. Just let me know if there are any issues with this moving on. But why we love the NBO in Tayside, so it fits in so nicely with the policies in Scotland. So we've got the Getting It Right for Every Child policy, which is based upon the UN Convention of the Rights of the Child, and that's such a focus on getting the right support for the right support at the right time for every child. And we have the voice of the infant, which is really about seeing the baby as a person with their own emotions,
Sorry,
their own voices.
yeah, Theophra, can I stop you? The slides
Yes.
are moving and we're still stuck on the first one.
Oh no. Let's see. Um, Let me see. I'll stop sharing and share again. That's all we need when we're
Yeah,
running through it. I wonder if I try this one. Is that coming up?
it's up. Yes.
Okay, great. Um, so yes, the voice of the infant, and we have the infant pledge, which is sort of a pledge that you can sort of see over Scotland, like we have it in our offices on the neonatal unit, and it's sort of speaking from the first person, given really highlighting that baby's voice, and that sort of laying out that commitment of what caregivers can do for the baby in terms of interpreting their cues, and meeting their emotional needs as well. We have a universal health visiting pathway in Scotland that Louise can talk a little bit more about, and that's thinking about, yeah, how the NBO fits into that as well. Hopefully this will move on. Hold on. So Gemma, I'll just hand it over to you for this part.
Yeah, so within NHS Tayside, we have 5 individuals that are trained in the NBO. We've got Louise that's on the call that's going to speak later to talk about her role as a health visitor in Dundee City. And then we've got 2 psychologists, Shifra and our colleague Viv, who are both trained in the NBO. Viv received an NBO bursary from Brazelton earlier this year. So it's lovely to have her up and running with us as well, delivering it to families. There's myself, I'm a psychological therapist, and we've also got an occupational therapist that works both on the neonatal unit and within the children's ward within Dundee. Her name is Zoe, and Zoe tends to see infants that perhaps present with more sort of medical complexity, and it's been really helpful to work alongside her, both in terms of her identifying families that might be more appropriate or could benefit from maternity and neonatal psychology input, and also for us to be able to access her knowledge and refer families on for her to do the NBO for parents as well. And I'll just go on to explain. Zoe she can't attend today, but wanted to outline her role within occupational therapy. She's just recently started to be the lead for a new hospital at home neonatal team, which has been great to support families as they are discharged from the neonatal unit. And she also has a role within the local children's ward. And so we wanted to share this, that she uses the NBO both within those teams and applies it within a variety of clinical settings, using it as a tool to support and strengthen the parent-infant relationship. She's noticed that it helps parents better understand their own infant's unique behaviours and capabilities. I think, as previous speakers have said, even if it's perhaps the parent's second or third babies, being able to see the baby as a unique individual. And through this lens, being able to identify areas where the infant may benefit from additional support in their co-occupations with caregivers. So thinking about feeding, bathing, and daily care routines. And these shared activities offer rich opportunities to promote brain development and foster deeper connections between the infant and the parent and caregiver. So it's been, really helpful to work alongside Zoe and get her knowledge, and just pass back to Shifra.
Thank you. So within the maternity and neonatal psychology team in Scotland, so we're different from the perinatal mental health team. Our caseload would be people with more mild to moderate psychological difficulties. So we can use the NBO and the Brazelton approach with people on our caseload antenatally and postnatally. So antenatally, we can be just speaking about the Brazelton using the language, and it really helps to visualize the baby, and that helps with bonding if there's any sort of difficulties there. And we can also set that up that the NBO is something we can do postnatally. And it can be a lovely way for us to end therapy with the people that we're working with because it's so strength based. So it really finishes with that lovely kind of wrap up with the NBO. Um, Postnatal, we would be seeing people who have had a birth trauma from, I suppose, a more psychological point of view rather than a medical point of view. So people who their birth experiences have impacted them psychologically, I suppose, and just thinking about the impact that that could have on somebody's ability to be interpreting their baby's cues or just even impacting their confidence with their baby. So the MBO is really helpful for just, I suppose, increasing that sensitivity to the baby's cues and increasing that confidence. We are based on the neonatal unit, so we can offer the NBO to all the babies in the neonatal unit once they're at that 37 weeks. But even before that, we will talk about the NBO. So we have babies from 23, 24, 25 weeks, and we can be speaking with the parents again about the Brazelton concept, the NBO, and then when they're at 37 weeks, we can do the NBO with the parents. And even just on our ward rounds, we can just sort of be doing small parts of the NBO rather than doing the full NBO. So within the neonatal unit, there are specific challenges. You know, parents and babies are physically separated, and that can be really difficult for people. There can be a sense of loss or grief over the pregnancy, the birth, and maybe the baby that they had sort of expected. There's often such a medical focus and a lot of fear and anxiety around what the baby's medical outcomes will be, what their development might be. So the MBO has been really good to just help bring that kind of strength-based approach. In terms of increasing awareness, we've been, as I said, speaking about the NBO and ward rounds to both parents and to the staff. We've done some training on what the NBO is so that the nurses and the doctors on the neonatal unit are more aware of it. And we've really noticed an increase in them approaching us to do the NBO and when the NBO might be really helpful. And we've also got some posters up and stuff like that as well. And yeah, offering it as a bit of an opt-in, you know, on the neonatal unit as well. So I'll share an example of an NBO on the neonatal unit, and then Gemma can talk to you a bit about the project that we're hoping to just start. So this was a baby who was about to go home, but was just staying on the neonatal unit for some feeding and weight challenges. Parents themselves were feeling very overwhelmed just within the neonatal environment and had expressed that they were really finding it hard to just enjoy their baby and just starting to see the baby as this sort of object that just had to be meeting these certain weight goals. Um, and also the baby, they were sort of using the breast at all times to comfort the baby, and noticing that the baby really hated getting its nappy changed. So there were lots of things that they were already noticing about their baby. So we went into one of the quiet rooms in the neonatal unit, and that just helped with, I suppose, the parents' regulation as well, and just how they could have the capacity to think about what the baby was telling us. And we were able to see the baby sort of really clearly transitioning through different states using self-regulation techniques, like taking breaks when they were looking away, their hand up to their face. Such a clear preference for the parents' faces and voices, which I think is really useful in the neonatal unit when, as has been said previously, there's so many different staff involved. So just to really show that this baby is so much more interested in you than me or anything. Um, so and also thinking about how to support the baby. So when the baby is getting, their nappy changed or anything, what can we be doing? Can we be swaddling the baby up here, or can we be just speaking to the baby, showing the baby our faces, and just different ways to soothe the baby as well, to give the parents a break, and the baby maybe doesn't always have to go to mum's breast, so dad can be really involved in that as well. So Dad provided some feedback for us afterwards that it really helped us see her as a baby and not an object. I'm just trying to move this. We will not immediately react to her to her fussing by picking her up. We will gradually try to comfort her. So really that kind of wait, observe, and then respond rather than sort of jumping straight in and maybe overwhelming baby at times. And their feedback was that it should be offered to all parents in the neonatal unit. Gemma, I'll just hand it back over to you.
Yeah, so we see now an opportunity to run a project on delivery of the NBO in the neonatal unit. So really focusing on reviewing its use within NHT side for families who are transitioning home, because we know that discharge is a point of increased anxiety potentially. So thinking about, is there an impact on parental confidence, parental responsiveness, and parental knowledge of communication cues, and utilising the Brazelton parent questionnaire to have a look into that and be curious with those aspects. So we've recently sought clinical governance approval for the project and hoping to provide an opt-in provision of the NBO for all neonatal families that have a neonatal experience, planning to either complete it in the unit or at home if families have been discharged. And like Shifra has said, putting up posters, putting up QR codes, signposting families to the Brazelton website for further information. And we're just keen to make it accessible to all, but also thinking about potential long-term benefits and whether there's other research studies that we could look into in terms of impact on parental mental health. So early days, but we're all very enthusiastic about it. So I think that's everything from us. We'll just pass on to Louise now, who's going to talk a little bit about her health visitor role.
Hi, thanks, Gemma. My name is Louise Lennox, and I'm a health visitor based here in Dundee City. And today I just want to talk about how EMBO has transformed my health visiting practice, and in actual fact, how beautifully it aligns with our Scottish Universal Health Visiting Pathway. I'm also going to share a couple of case studies to highlight the impact that me doing the EMBO has had on the parents that I have worked with. EMBO literally gives infants a voice before they can speak, and I feel it really strengthens that early bonding and emotional safety. It supports that lovely parent-infant interaction through these attuned interactions. So the Universal Health Visiting Pathway, which you can see in front of you, it encourages relational strengths-based practice, and what I would say is that EMBO just embodies this perfectly. It encourages us to slow down and see the baby. It helps us interpret cues, and it really boosts parental confidence as well. So you can see here the Scottish Universal Health Visiting Pathway. It's 11, so it's a minimum of 11 contacts or touch points from first antenatal visit right through until that child transitions through to school. So maybe between the ages of 4.5 up to 5.5. And using the, so my first visit at the antenatal, I will first introduce behavioural states, talk about early bonding using that Brazelton approach, and I will be signposting parents to the Brazelton website. I want them to watch the videos because I've had that first discussion about infant behavioural states. We then take over from the midwives between day 10 and day 14. So then we become the named person. So at that first visit, I'm having those first EMBO-based conversations and about, families, watching them beginning to recognise their baby's strengths and over the coming. So it's a great opportunity for me to be able over the first few weeks to just integrate the EMBO as part of my work in terms of that first visit, head to toe examination. And what I've done is I've completely incorporated the EMBO into that. And you can see over the subsequent weeks when we visit in the home that patterns become clearer. You can see that the parents are starting to recognise cues more easily. And it's just such a lovely thing to be able to do because the ENBO principles just naturally weave themselves into that assessment, attachment work, and those really early conversations with parents. And I think for me, EMBO really makes these early visits, they feel more human, they're more connected, they're more meaningful, and I think parents really feel reassured when they see the strengths in their baby being highlighted. And I think as well, one of the biggest things I think since becoming trained in EMBO, and I've been using this for a couple of years now, that conversations have very much shifted away from, I think, what could easily become all about checklists. And it's much more about shared discovery of, their parents and their baby. And my little blue Brazelton bag is with me absolutely everywhere I go. Can we move on to the next slide, Shifra? So I've just got a couple of, yes, okay. So this was just such a lovely thing that happened. I was in a visit and it was very young parents. So I was in the lounge with mum, and we were oohing and eyeing over her lovely new baby that had just arrived, and I had just come out to see. Had been out to see them antenatally, and this was me coming out from a first visit. And Dad bounced out of the kitchen, announcing to me that babies can't see. And it was great because I thought, I'm not going to say anything. I'm just going to show you and just keep my fingers crossed that baby was going to do what I wanted them to do. And came to the point when I introduced the red ball, and it was absolutely incredible. See, he was, watching what his baby was doing. And this baby, it was textbook, absolutely tracked the red ball midline to the side, back to midline and round again. And this dad nearly fell over. And what a beautiful thing to be able to do for, for a family, because it was this perfect show, not tell moment. And it really strengthened that dad's emotional connection to his baby. And again, I think changed how he interacted with his baby from that moment on, that he really felt he could really see his baby as a wee human, and not as this little blind thing that needed to have things done to it. And it was just absolutely magical to watch. Could you move on to the next slide for me, Shifra, please? So this was another real aha moment, which again was really just a lovely demonstration of how powerful ENBO actually is. So I was in the house with mum, dad. I think this really is a great example of dads being included. And I think very often, I think what we see in practice and up here as well is, again, how can we include dads? And I think EMBO really is a powerful example of actually how it does that without really even trying. So we were chatting about behavioural states, recognising when baby's becoming overwhelmed and looking at what cues their baby might display and how they would interpret that. And as we were having that conversation, Dad suddenly stopped and went, "Hmm." And he reflected back to something that had happened earlier on in the day, that him and mum, so mum and dad and big brother, very excitedly, right in baby's face, all really close up, interacting with their wee baby, thinking this is great. Baby was initially enjoying it, and all of a sudden, baby just became really distressed, burst out crying, and was really inconsolable. And when he thought about it, he hadn't recognised. He thought, "Oh, why was that? What had happened?" And through this discussion about looking at babies' cues and looking for those little indications that they're starting to feel a bit overwhelmed, he absolutely, it was such a powerful moment of dad actually being able to interpret his baby's cues for himself. And I think that really demonstrates EMBO's impact on parental understanding, again, which is incredible. Can you move on to the next? Yeah, so you can see, yes, just an amazing moment of parents reading their baby and feeling they were very proud of themselves, and again, just changed the way things. I think things, that really been able to connect on a really deep level with their baby. And yes, it's just a privilege to see Embo magic at work. And it's just, you're not really doing anything. It's really between the baby and the parents. Can you go on to the next slide, please, Schaefer? That's lovely. So what brings us together here in Tayside, and I think all of us sitting here on this presentation, it's that shared love of understanding babies and their absolute brilliance. And it's, Embo, it's relational, it's strength-based, and it's such a joy to be able to do it as a practitioner and sharing that not only with colleagues, also with, the parents and the babies in our caseload. For us, it just fits perfectly with our Scottish policy, and also the Scottish Universal Health Visiting Pathway. Again, it's a bridge between disciplines. We all see babies' cues, and it's this shared language, again, that's been constantly referred to, shared language across professions that we can use with parents and their infants. And I think parents love it. It just brings their baby's personality to life. And I think really importantly, it reminds practitioners to slow down, to observe, and to attune themselves. Yeah, so it's a game changer, isn't it? I think if we could wave a magic wand, we'd have every single practitioner that is working with parents and infants trained in ENBO, and what a wonderful place it would be. So yes, stronger relationships, empowered parents. And I think for us here in Tayside, this multidisciplinary team approach, I think I think we all agree that it's full of potential, and I think we all want to continue meeting up and see what we can do to work together, and take things forward up here. Thanks.
Thank you so much to all three of you from Tayside, Zifra, Gemma, and Louise. Absolutely great. I'm just so impressed with the collaborative working the three of you achieved with a few more colleagues. And I'm sure there's many people, if there's any health visitors left here, just feeling jealous of all these visits and contacts that you have with families. Love the aha moments and more case studies. And yeah, I think, as you were just saying, Louise, this kind of brilliance that babies can show us. It's what makes definitely me smile, and I can see others smile as well, because they can just tell us so much and share so much about themselves. Great to see the case studies with dads as well. That's wonderful. And thank you for sharing also, because I know there were some questions from the audience about how MBO can be used in the neonatal care unit. So thank you for sharing that. I don't know if there's anybody who has got any questions. You're free to shout out or put them in the chat. But just to say that we here at the Brazelton Centre UK are, part of a very, very big international network. We have centres all over the world. If you have got any questions, please don't hesitate to contact us. The whole recording here will be shared with all of you. So it will be on YouTube. So you can watch it from there if you want to go and revisit it, or there's anybody else that you work with, you think, oh, it would be helpful for them to see it as well. So you feel free to share that as well. So I don't actually think there are any questions, but of course, if you do have any questions, do contact us any time. So with that, yeah, thank you all for attending. Thank you for sharing. Thank you for listening. And I hope you all have a lovely day. Thank you.